The country's pandemic tally continues to improve. We're showing you our numbers for today. 2,087 new infections, 32,077 active cases, the lowest in 8 months. And the positivity rate at 5.2%, just 2 points shy of the World Health Organization's 5% benchmark. 8 labs failed to turn in their data. The Philippines has also improved in Nikkei's latest COVID-19 recovery index. From being dead last out of 121 countries in September, the nation has climbed 18 spots. Let's make sense of these developments with Grace Lee of Nikkei Asia, joining us now live from Tokyo. Grace, thank you so much for joining us. Tell us, why is the Philippines no longer the cellar dweller in this latest Nikkei COVID-19 recovery ranking? Which categories has the country improved on?
Thanks, Rico. Pleasure to be on your show again. For the ranking, it's the infection management category where we're seeing significant improvement. The Philippines gets a score of 16 for this category in this latest ranking compared to only 6 points last month. This is a 10-point increase, while for the other categories, vaccination remained the same and the mobility added 1 point. So mainly it's the cases falling down from the September peak that has helped push up the total score and the ranking for the Philippines.
So we've seen a massive improvement in infection management from the Philippines. It has climbed 18 spots, but still quite low compared to the other countries. It's at 103rd place. Which categories, Grace, shows that the Philippines still needs improvement?
We can see that vaccination is going fast, and by the end of October, the Philippines was giving more vaccine doses per capita than 70% of all the countries. But in terms of the cumulative doses given and the share of fully vaccinated population, the Philippines still lags 2/3 of world countries. That's something the country needs to catch up on.
We also have to catch up on distribution of these vaccines across the archipelago, because now we have a vaccine supply of over 100 million. What does your research tell you about the storage of these vaccines and the distribution? Is there a problem here?
Actually, the data we're using for the ranking mainly looks at the end results. The relevant one here would be new vaccine doses given per day per capita. And for the Philippines, that number was back to a high level by late October, and it has continued to rise this month. So it appears the government is ramping up efforts on distribution.
That's why we've also seen the ranking of the Philippines jump by 18 spots from 121 to 103. But how does the country, Grace, compare now with our Southeast Asian neighbors such as Thailand, Indonesia, Vietnam, Laos, and Myanmar?
So Indonesia ranks 41st this month, the highest among Southeast Asian countries included in our ranking. It has really low infection numbers now compared to its peak number. Cambodia and Malaysia are 47th and 50th, respectively. Both rank top 10 in terms of vaccination. Laos is at the bottom this time as new cases continue to rise in record numbers. The rest, Thailand, Vietnam, and Myanmar, rank similar to the Philippines, between 95th and 108th.
Last month, when Nikkei Asia came out with its report and the Philippines was dead last at 121, there was a lot of criticism from the national government saying that Nikkei did not really know what it was doing. Share with us, where do you get this specific information which you are using to base your COVID-19 recovery ranking?
We look at testing capacity, new COVID case numbers per capita, and the vaccination data from statistic website, Our World in Data. We also look at mobility measurements from several sources, including the Google Mobility Reports and also the Oxford Stringency Index. We got the flight activities data from a company called Cirium. They specialize in aviation data and analysis.
Credible information that many countries cannot really question. Thank you so much for joining us on The Final Word. Nikkei Asia's COVID-19 Recovery Index, Editor Grace Lee.